This is my immediate care of the newborn skill. So the first thing that I want to do is make sure that I have everything prepared, ready for the baby. I have my warmer ready. I washed my hands. I put gloves on, and that was fast. My baby was born. So I want to place my baby in the warmer with its head slanted down to facilitate draining. I want to dry my baby and stimulate my baby to cry. So I'm rubbing its back. I'm rubbing the palms of its feet, and my baby's crying. So the next thing that I want to do is put a hat on my baby to prevent cold stress. I want to suction my baby's mouth, suction my baby's nose. I want to perform an APGAR score at 1 minute and at 5 minutes. So I want to look at its activity and muscle tone, and I would score it a 2. I want to look at its pulse. And its pulse is more than 100. Its apical pulse. So I would score it a 2. I want to look at its grimace. And it's actively grimacing whenever I touch it. So I would score it a 2. I want to look at its overall appearance. I see no signs of acrocyanosis, so I would score it a 2. Its color is pink. I also want to look at its respirations, and its respirations are within defined limits, so I would score it a 2. And then I would do that again at 5 minutes. Then I want to assess my baby's cord. So my baby's cord has 3 vessels that I can see, and I don't see any significant signs of bleeding. I want to identify my baby against the mother's bracelet and also the mother's records. Place the bracelet on the baby's foot and also on the baby's arm, because most facilities do use 2 bracelets. I would want to remove my wetness from my baby to prevent further cold stress. I would want to do eye prophylaxis, so I would use one side of the cloth to wipe one of its eyes and another side of the cloth to wipe the other eye. I would use my erythromycin in its eyes. And I would administer vitamin K in the thigh as ordered. Then I would swaddle my baby to keep it good and warm. Now my baby is ready to give to the mother for kangaroo care, and I would document my assessments and report my findings.